That's why I'm saying you have to develop a system so you don't forget.
Good morning, Mr. Lee. I'm candidate 417. Today I'll be performing the exam on you, alright? First, we're gonna check your lens inside your eye using the slit lamp, okay? So first, I'm gonna have you sit behind the slit lamp, which I have cleaned earlier. And then it has been focused as well with the focusing rod. Are you comfortable there, or you want me to go a little bit higher?
Higher.
A little higher?
Maybe you lower.
Better?
Okay. Yeah.
Comfortable?
Okay.
Okay. Now I'm going to turn off the light with the back of my hand. I'm going to now turn on the slit lamp. I'm going to have a optic section at a higher mag. I'm going to have you look to the straight, look straight. Okay, so I'm going to have an optic section. A little brighter here. So starting from the outside, which is the left, we're looking at the anterior capsule, looking for any cataracts, which I do not see any. Next, I'm going to the cortex, looking for any cataracts. I do not see any here. Now going in towards the nucleus, see a bit of yellowing, indicating a grade 1 nuclear cataract. We're going deeper, we're going to look at the posterior capsule. There's no cataracts there. So now I'm going to flip my light source. We're going to go back out, checking the anterior nucleus for any cataracts, which we do not see any. And as we go to the cortex, you're checking for any cataracts, none there. Going a bit deeper, we go into the nucleus, see a bit of yellowing, grade 1. Going a little bit more, going to see the posterior capsule, no cataracts there. As we go in a bit touch more, have you look up, down, straight. See there's no vitreous strands in the anterior vitreous. Now we're going to do a retro of the lens to check for any opacities. As we do that, you see a bit of vacuoles, which is okay. I'm going to change the beam to a smaller beam. Check for that red reflex. I'm going to introduce the lens to the eye. Going to the nerve. See the optic nerve is focus. Oh, there. Okay, we see the nerve is in focus. CD ratio is around 0.3 horizontal, 0.3 vertical. Neuronal rim is pink and healthy. The peripapillary area is a little bit of a scleral crescent. See the margins are distinct. Going to go up to the inferior arcades. Going to the inferior arcades. Looking for any vascular changes. So much. Okay, looking for vascular changes. I go temporally. Go temporally. No vascular changes. I'm going nasally. I'm going temporally now. No vascular changes. Going superiorly. Checking for any vascular AV ratio is 2 to 3. I'm going to go temporal. Temporal. No vascular changes. I go back nasally. No temporal changes. Vascular changes. Going back to the nerve, and I'm going towards the macula. I go towards the macula. Sinofoveal reflex, it's healthy and clear. I go back to the nerve, pulling out. See a Weiss ring indicating a posterior vitreous detachment. Okay, so now I'm having you sit back. Posterior structure of the eyes are healthy. There's no vascular changes. So that's good. All right. So next we're going to do BIO. Now we're going to check your posterior, the back of the eye, but in the periphery. Okay. Now I'm going to put this on. Should the beam source should already be there. So over towards the patient. We'll have this go up.
Do it on.
I'm gonna have you go to the front of your chair. Just don't lean. Have you look at my hand, okay? I'll have you look up and to your right. I'll be looking at the superior temporal angle.
Sure, look at this side, isn't it?
I'm doing the other side now? Oh, that's right. Alright, so I'm gonna have you look up and to your right. I'm gonna look at the superior temporal angle. No holes or tears or regular attachments. Proctor, do you have a view? Yes. Okay, I'll have you look up towards your superior. With the superior angle. No holes, no tears or regular attachments. I'll have you look towards your nose up here. No holes, no tears, no regular attachments. Right, that's fine intact. Proctor, you have a view. I'll have you lower a bit. I'm going to have you look out to your right. I'm looking at the temporal angle or quadrant. No holes, tears, or regular attachment. I see the longitudinal ciliary nerve. Now you look towards your nose. Big one, isn't it? No holes or tears around the attachments. After you have a view. Now I'm going to lower you a bit here. Now you look at my stomach and to my rib cage out here. Out here, look for it. I'm looking at the inferior temporal quadrant. No holes, no tears, no metal attachments. Proctor, do you have a view? Yep. I'm going to look at my belly button just a little bit above right here. Looking at the inferior quadrant. No hole, no tears, no metal attachments. Proctor, do you have a view? It is intact. Stomach into the here. A little bit higher. No holes, no tears, no random detachments. And as intact. Proctor, do you have a view? This one's a little uncomfortable, but bear with me. How you look at my left ear over here as I evaluate the posterior pole of the eye. CD ratio is 3:3. Posterior looks whole, flat, and healthy and intact. Good. So now your, well, I'll just say, the periphery of the back of your eye looks healthy. There's no holes, no tears, or any pathology indicating otherwise.
Okay, that's good. Thank you.